Welcome to the Measures Registry webinar. It's just 2 o'clock and we're going to go ahead and get started. My name is Jill Reedy and I'm here at the National Cancer Institute with my colleague David Berrigan. We'll be presenting to you on behalf of the Measures Registry Work Group. Our objective of the webinar is to describe the features and the functions of the Measures Registry, a new tool from the National Collaborative on Childhood Obesity Research, also known as NCCOR. Here's the outline of what we'll be doing here on the webinar today. I'll start by sharing some background information about the project, and then we'll walk you through a brief demonstration of the search feature in the registry and point out the details that are included on an individual measure's profile page. David will then share additional features and resources, including measures in development. David will close with some key findings from the project and discuss next steps. Then we'll open it up to your questions. So please be sending us your questions through the Q&A feature on the webinar. Many of you have heard of NCCOR already, but for those of you that haven't, NCCOR brings together 4 of the nation's leading research funders to address the problem of childhood obesity in America. These collaborators include the Centers for Disease Control and Prevention, the National Institute of Health, the Robert Wood Johnson Foundation, and the United States Department of Agriculture. NCCOR's overall mission is to improve the efficiency, effectiveness, and application of childhood obesity research and to halt and reverse the current obesity trends through enhanced coordination and collaboration. NCCOR really focuses on efforts that have the potential to benefit children, teens, and their families, and the communities in which they live. A special emphasis is placed on the populations and communities in which obesity rates are highest and rising the fastest. These include African Americans, Hispanics, Native Americans, Asian Pacific Islanders, and children living in low-income communities. NCCOR has 5 strategic plan goal areas, and the Measures Registry, which we'll be talking about, is most closely linked to the first 3, to identify, design, and evaluate practical and sustainable interventions, to increase and improve surveillance at multiple levels, and to increase the ability of childhood research and program evaluators to conduct their research and program evaluation. The other goal areas are also listed here, and they include providing national leadership to accelerate implementation of evidence-informed practice and policy, and working with non-health partners to integrate childhood obesity priorities with synergistic initiatives. I'm going to go ahead and check and see if we can get better sound quality here. We're hearing from some people that the sound quality isn't good. Please let us know if this helps. I've just changed a few things here. So with these goals in mind, the strategic goals that I just talked about, NCCOR has released 2 new tools for childhood obesity research: the Catalogue of Surveillance Systems, which is an online searchable directory of relevant surveillance systems. And that was released in February. And then the Measures Registry, which we'll be talking about today, which aims to provide an online searchable registry of relevant measures. And the Measures Registry was released in April of 2011. So as you know, researchers are facing complex issues when selecting a measure. Where can I find a specific measure? What are the measures that have been validated, or how has a specific measure been validated? How have other measures been validated, or has that measure been validated within the specific population that I'm interested in studying? Where can I find more details, and what are some of the costs that are associated with that? So with these questions in mind, NCCOR developed the Measures Registry. And as I just mentioned, a key priority for NCCOR is promoting the use of common measures and methods across childhood obesity prevention and research. Standard measures are needed to describe and evaluate interventions, particularly those projects that are addressing policies and environments. And the aim of a Measures Registry will facilitate identification of existing measures, help identify gaps, and fuel new measurement development. So Okay. So what are measures? We've defined measures broadly as tools and methodologies to assess diet, physical activity, and the environments in which these behaviors occur. Examples of measures in the registry include questionnaires, instruments, diaries, logs, electronic devices, direct observations of people or environments, protocols, and analytic techniques. I'm just going to pause here and please let us know if you're having problems again with the sound. We are getting a few questions here from a few people, but I think overall we're suggesting if you're having problems to go ahead and call back in. So let's go ahead and look at some of the inclusion criteria that we had with the development of the Measures Registry. To develop the registry, we categorized the literature into 4 different domains, and these include individual dietary behavior, the food environment, individual physical activity behavior, and the physical activity environment. We conducted literature searches for each of these 4 domains, including articles published between 2004 and 2010. We also examined an extensive best practice review that was completed by Transtria and drew from a set of foundation papers and resources, some of which were from prior to 2004. We also then followed up with subject matter experts to supplement the lists of measures that we had. For each article with a relevant measure, we collected data to develop each measure entry, or what we'll refer to as a measure profile, using a tailored abstraction tool. We developed the abstraction tool with feedback from our expert panel, a selected group of leaders in the measurement of factors related to childhood obesity. From each article, specific details about how each measure was gathered included the domain or the domains measured, the validity or reliability testing, protocols on use, settings, geographic areas, and also the populations for which the measure had been used. The registry was designed based on recommendations from formative research and user testing, and these guided interviews with both researchers and practitioners yielded critical information about how to design the interface and orient the information that you'll be seeing on the website. The Measures Registry was launched in April of 2011 and currently has nearly 750 measures, and we'll be continuing to add measures to the website, and you'll be hearing more about that from David in a little bit. The registry allows users to search for measures, to access specific details for each measure through the profiles, to link to other measures registries and related resources, to find measures in development, to submit new measures for inclusion. And I'll demonstrate these first 2 features now, searching for a measure and accessing specific details within the measure profile pages. So let's go ahead and go to the Measures Registry. As you can see here, the Measures Registry is part of NCCOR's website. What we're looking at now is the home landing page from which you can do several things, as I just mentioned, and as David will detail in a little bit. But now we'll go ahead to search the registry, and that's the green bar here. On the left-hand side are the filter options. Not only can you search for specific text or keywords within an abstract here in the search box, you can also filter by pre-specified categories, and these include the domain, as I talked about earlier, the particular measure type, a particular age group or age category, or the location, or the location or context. So, for example, a quick filter would just be to click on a particular domain, in this case, individual dietary behavior. And you can see that there are 171 measures for individual dietary behavior. In the results section, then, you can see the names of the measures, along with the first author and year published. From this list, you could then click on any measure for more information. So let me show you another example here. And if we wanted to just search by a specific author, we could search by their last name. In this case, for Billy Giles Corti, we can see that there are 12 measures of hers showing up in the results section. And if we wanted to look at additional details of one of these, let's say, for example, the Public Open Space tool or POST, then we could go ahead and click on that. And you can see that this link takes us to the profile pages for that particular measure. And so here are the data about how this measure has been abstracted, has been sorted into 6 different tabs. And you can see those across the top here: the abstract, at a glance, study design, how to use, validity, and reliability. And we'll go through each of those in turn. But as you can see on the abstract tab, the citation and the abstract are listed here. You can also see a link to the abstract in PubMed, a link to the full text article when that's available, and then a link to the measure itself when that's available. So you can go ahead and see that here. This is an actual PDF of that particular measure. Next, we'll click on the At a Glance tab to get a brief overview. And we can see that this measure, the Public Open Space tool, assesses the physical activity environment and is an environmental observation with 35 items. Again, the measure can be accessed through this link here, and there'll be some additional information there, and that takes you to another window. We can also see that this study took place in a metropolitan area in Australia, and that the tool was conducted in English, and there was no additional information to be added about the development of the measure in this particular case. The specific physical activity environment variables are also listed then in the other column, and you can see those here. And we can see that more than 500 public open spaces were surveyed.
Jill?
Yes?
We can't see your desktop.
Oh, you can't? Let's see. How can I'm sorry, it sounds like you can't see the desktop that I've been showing.
Yeah, we can hear you, but I was trying to message you, sorry.
That's okay.
So click on the share desktop icon again and see if the little animation comes up. It should come back up. There we go.
So can you see it now?
Yes.
Okay.
Thank you, sorry.
That's okay. Okay, so let me just go back for a second so you can see what I was doing here then. So for example, here the way we got to this particular search was to go ahead and type in, type in the author's name here in the search category, and then you could see the 12 different measures that were authored by Billy Giles Corti. And we wanted to go ahead and look at the Public Open Space tool. So we went ahead and clicked on this link. And then you can see here on the Abstract tab, the citation and the abstract. And we could actually go click on the Abstract tab and get that in PubMed, or the full text of the article, or also the measure. So here we went ahead and clicked on that, and you can see the PDF of the measure. And then we could go ahead and go back to that Abstract tab. And then we were on the At a Glance tab, and we were looking at the specific details. Here, a little snapshot to show us that it's a physical activity environment tool that is an environmental observation. You can see the number of items that were reported and the study location and the language that that was done in. Then the physical activity environment variables are also listed here. We can see that more than 500 public open spaces were surveyed. And the objective measures related to quality, access, availability, proximity, aesthetics, pedestrian infrastructure, and so on are also included. Then we could go to the Study Design tab, which includes details regarding the type of design and other details about the study participants that are included in the article. So because this is an environmental tool, this is an example of where we don't have a lot of additional details on the study participants because it's an environmental tool. However, you can see that the study design included validation, reliability, and correlational and observational attributes and physical activity was the health outcome that was assessed here. The How to Use tab gives specific information about who administers the tool. In this case, it's the researcher administered, how it's administered, here by direct observation, the time required. Again, you can see here that it's about 10 to 15 observations were completed in a day, and whether any training is requirement, and if there are additional instructions on use. And here you can link to those through their website. On the right-hand side, you'll also see information about data analysis and costs. Here, this information wasn't available in the article, but additional instructions on data analysis were included in the article. The Validity tab provides details about the type of validity and associated test statistics that may be included in the article. Here, there's information about content validity and predictive validity. And similarly, the Reliability tab includes details about the type of reliability and associated test statistics. So here you can see that inter-rater reliability was assessed for post items in 4 different domains. So the button next to the measure name here will take us back to that search and browse page so that you can be ready for another search. And I'm just going to, I think because I wasn't showing you the screen, or you couldn't see the screen when I went through this before, but just to point out again, these filter options here along this column are not only can you search by particular text that you're interested in or a particular name of a measure, you could also use these pre-categorized variables by domain. And if we wanted to just, for example, look at individual dietary behavior, we could see that there are 171 of those. You could also click on measure type and or age and or context. So from this page, we can also go back to the home page and explore those pages further as well. And this is what David will be talking about next. So I'll turn it back to our slides here and turn it back over to David. Oops. You can see. Let's see, I think that it looks like we may need to, there we go, it's coming back up. Okay, we're logged back in. Here we go.
Hi everyone. Thanks very much to Jill for describing the search feature of the Measures Registry, and thanks to all the listeners for dialing in. Our apologies for the minor technical glitches. My name is David Berrigan, and I'm a biologist here at NCI, a member of the Measures Registry development team. This is my first webinar, so I'm slightly nervous. In this second part of the webinar, I will show off a few more features of the registry and describe our next steps. The first feature that I want to highlight is the Measures in Development page. Measures in development are defined as those measures without a peer-reviewed validation or reliability study that was published for abstraction. So these are just lists of resources. You can access this page by clicking on the Measures in Development button. And you can see there's a list here of about 40 measures in development. We are keen to include more of these measures and are relying largely on people to send us their measures descriptions and contact information. So this means you. If you're developing a measure, we'd very much like to hear from you. In this next slide, I illustrate a screenshot of the Other Resources page, which you access by clicking on that button. And Other Measures Resources are sites directly related to measurement of childhood obesity relevant variables. We currently have about 30 links here covering some of the different domains that we've addressed. And again, please send us information about Measures resources that we've missed. So I've been calling for feedback. As you might expect, there's a feedback page, and we hope you'll use this to send us all kinds of feedback. Especially, we're interested in other resources, measures in development, and very much in actual measures available for papers that we've abstracted. So far, we have about 200 measures that are directly available online, and we'd love to collect a complete set of those so that people can download a measure when they need it. So in the process of developing the Measures Registry, we've been very interested to see some features of the landscape of measures related to childhood obesity. We identified nearly 750 measures for abstraction, about 250 of those with links to the actual measure, about 200 measures in each domain, a fairly balanced use of measurement modalities between observation, instruments, and questionnaires of various types. A great deal of variation in assessment of validity and reliability across domains. For example, the diet and individual physical activity domains were much more likely to have estimates of validity and reliability of the measures. There were few measures of behaviors in rural areas and rural environments. For example, of 200 measures of the physical activity environment, 159 were specific to urban settings and only 25 specific to rural settings. There were many fewer measures for preschool-age children, perhaps reflecting challenges in working with them. And only about 5 to 10% of the measures were translated into Spanish or were available in Spanish. And we're continuing to take a look at the registry to try to identify features and gaps of this set of measures of obesity, childhood obesity-related variables. So I'll tell you a little about what we think is coming next with the registry. We're going to update the registry to include publications and measures that have appeared in the literature since 2010. We hope to finish this process by summer 2011. Then we're going to enter into a period of ongoing updates beginning in the fall, where we try to keep caught up at a time interval yet to be determined with ongoing publications. We expect that to be monthly or quarterly. We're going to revisit pre-2004 measures-related publications to complement the key reviews approach that we used. For papers published before 2004, we used authoritative reviews in the different literatures to identify major measures, and we're going to revisit and use a search-based strategy as well to find additional measures from before 2004. And then we have an ongoing plan to incorporate emerging measures as we receive information about them, and we'll reach out to our various constituencies to try to urge people to send us their emerging measures. I'm going to just talk for a few more minutes about the remaining challenges that we see. We've been talking about incorporating additional domains, for example, characteristics of family structure or measures of obesity. Then a major challenge involves further characterizing the quality of measures. Which measure is best? This is related to the problem of standardization of measures, to harmonizing different measures, and to developing new technologies and measurement modalities. So whenever we show the registry to people, they ask, okay, I see there's several measures that seem suitable for my project. Which one should I pick? And I think this is a top challenge in the area. There seem to be a number of different ways you could address this issue. We could rank the measures by reliability or validity. We could identify expert panels or start some consensus process. We could try to foster guidelines or documents about best practices in measure selection. People have discussed developing expert systems to guide measure selection. We could define needs and design and validate optimal new measures. So this is clearly an agenda item for NCCOR, and it's not clear exactly what we'll do yet, but it's one of our top priorities to think about how to move beyond a registry of measures towards a system that can help guide people and accelerate the use of the best possible measures in their studies related to childhood obesity. So the intended outcomes of the registry and also of our related resource, the surveillance catalog, which I know many of you already know about, is to increase awareness and use of resources, to increase research productivity, to identify gaps in surveillance and in measurement capacity, to increase the effectiveness of childhood obesity research, to increase standardization of measures, reduce redundancy in measures development, and increase innovation in research. So ultimately all this, of course, is aimed at reducing rates of childhood obesity and its concomitant negative health consequences. So we want to acknowledge the registry development team, especially the NCCOR working group, with representatives from AED, USDA, CDC, and a number of RWJF and our various partners. The data abstraction teams coordinated by Mathematica Policy Research, which included experts from all over the country. And further, an expert panel which advised us on registry design and contents. The Audrey Lips of User-Centered Design for website design, and Jean Sear and Bran Handley for website development from Information Management Services, and Ann Brown-Rogers for editorial assistance. So thank you very much for dialing into this webinar, and we have an additional half hour scheduled, so we're going to stay on the line and respond to questions for the next half hour or for as long as there continue to be people typing in questions. Thank you very much.
I think we'll go ahead and look at the questions here.
Where should we start?
Yeah, where should we start? Let's see. Let's go down. I think if we scroll down a little bit, some of these are related to folks not being able to see the screen. And then here's the first question. And I just want to check and be sure that you can hear us now. We're both on speakerphone now. We'll check and be sure. We're going to go ahead and click on the Q&A tab. And the first question is, are only published measures represented in the database? And this is a great question. So we have the search the registry section, which I went over. And then there's also, and all of those measures are drawn from the published literature. And then when David mentioned what we're referring to as measures in development, those are available in a different section of the website, along with some of the other resources. So those are also available as well. So we're really interested in continuing to populate both of those sets of measures.
The next question that we see is, are all measures free to access? So what we've done with the registry is where the measures are free and are available, we've sought to include a link either to a home page that contains the measure or to a PDF of the actual measure. And where those links are available on the abstract page for the particular measure, then the measure is free. Measures that aren't represented may either not be free, the author may prefer to have you contact them directly, we may just not yet have found the measure, or it may be a measure in a domain where there's not exactly a sort of measure available. This might be a GIS script or a protocol from an environmental observation or some other kind of procedure where it isn't exactly clear how to post a measure. So at the moment, as I said, there's around 200 measures that are available, and we have some staff continuing to work to collect the measures. And finally, let me urge you, if one of your measures is represented here, we'd very much like to post that measure on the registry, and this is to your advantage because it will encourage people to use your work.
So I think that I'm reading this next question that says, have the measures available in Spanish been validated in Spanish? And this is a really great question. Basically, what we were trying to articulate is we looked at the literature and abstracted information about measures that were in the literature. And so if there was a validation, for example, if there was a validation done in Spanish, then we've collected information about that. However, there may be a measure that was used in Spanish where validation wasn't either published in the article or wasn't done in the measure, and in that case, that's indicated as well.
The next question is there any plan to include behavior change measures? So we haven't explicitly incorporated behavior change as an abstraction criteria or as a domain, but it's definitely on the table as a variable that would be of considerable interest because we want these measures to be used in evaluation and research projects about efforts to both characterize behavior and to characterize the response to interventions. So that's there isn't an existing plan, but it's definitely on the table. And so thanks for articulating that as a need.
And just to follow up, there are in the Measures Registry different measures that were used for particular behavior change interventions. So, for example, I'm thinking of different dietary interventions or physical activity interventions. So there are some of those that obviously would be included as well. Let's see. If I find a measure on the website, do I still have to contact the author to use it in the study? So that's a great question, and I think that the availability for the measure, it is there. For when you can find a measure, it is something that's available for you to use. It may also be very helpful to follow up with the author, either to get more information about specific protocols that were used, or if you find some of the abstracted data about what kind of training was required, that may be helpful as well.
But to be clear, we believe the measures posted on the registry are in the public domain.
Yeah.
So they are free to use, and you're not required to contact the author to use it in a study. Of course, it's a courtesy to acknowledge them by citing their work. The next question, who is allowed to create new measures? These measures are abstracted from publications in the peer-reviewed literature, and so anybody is allowed to create new measures, and they're arising in all elements of the scientific community. For the section of measures in development, we haven't come up with a precise vetting program, but we expect those to come from the research and governmental communities who are engaged in childhood obesity research and programmatic evaluation.
This next question is a little specific. It's saying, what would be the best way to find measures applicable to healthy corner stores in rural communities? This is a great question. I'm excited to see someone interested in this. And I would go to the search page, and you can either in the search text box go ahead and include, some of the language that you have here, healthy corner stores, or rural communities. You can also filter by location or setting. We have metropolitan area and rural area, so you could select rural there to pull up just those studies that were done in the rural setting. You could also filter by particular domain. So here, if you were particularly interested in the food environment, that would help you with your filter as well. So you may want to try a few different strategies to come up with a list and see what is really the best measure for what you're looking for.
The next two questions, what do you think about self-reported obesity-related data? And have you sent the link to the website to societies that study obesity, for instance, the Obesity Society, to suggest additional useful measures? They have a pediatric obesity section that would likely contribute many measures for items not represented. These two questions, I think, are kind of related to each other in that they touch on a couple different issues. One is measurement of anthropometric characteristics and obesity themselves. Here there's an extensive literature and an extensive discussion of the role of self-report in height and weight. And so for the registry, we chose not to address the height and weight and anthropometric characteristics. We felt this was more the physiological domain rather than and an area that had been reviewed extensively and started to drift into a whole complex of measures of a huge realm of physiological characteristics rather than behavioral characteristics. So we haven't yet grappled with that. On the other hand, the self-report issue is also related to the challenge of measuring diet and physical activity. And I think that's an extremely interesting and deep question right now in this literature, but not one we can answer on this webinar. For the contacting the Obesity Society and other professional societies, we're engaged in an elaborate outreach program where we're trying to both share about the registry at a bunch of different scientific conferences and to a bunch of different lists, and also to reach out to experts in a lot of different fields to get feedback on how we should continue to expand the registry.
And just to follow on with that, in some of our initial planning meetings with the work group, David, I remember you were talking about this very issue with anthropometrics, and I think at the time, this was a couple years ago, there was a consensus meeting also that was going on regarding pediatric measurement. And so we're also anticipating that some of the findings from that meeting will also be coming out, and we'll be able to link to that on the registry as well. I mean, that's just sort of for additional information.
You want to do this one?
Let's see. Am I correct in understanding that you're using the terms measures and measurement instrument somewhat interchangeably? So this is I'm really glad we got this question, because I think that one of the things that we found through working on the Measures Registry is that this question about sort of what is a measure is somewhat confusing, or people are using the word measure in different ways, and we've really defined measures broadly to include tools, and so that would include measures, instruments, tools, and also methodologies. As David mentioned, there are some, for example, GIS protocols and things like that are used. So any of these tools and methodologies that are used to assess individual diet, physical activity, and the environments in which these behaviors occur.
The next question is, what is the email that you were to send measures to? We hope that people will use the feedback page, which has a button to it on the Measures Registry landing page, and it includes fields which you can enter all the information that you might like to share with us. Thanks for that question. It's good to repeat that.
Let's see. Can one locate measures in the registry that are derived from administrative data, medical record sources versus surveys? I'm trying to think of an example here.
Yes, I could take that question. We haven't made an active effort to catalog administrative data and medical record sources, but we do have in the other resources and in the measures in development some material that's related, that's associated with administrative data. But again, that's an area that we haven't yet completely populated. And thank you very much for that question, because I think that's a good idea to further explore how we might populate the registry with material concerning childhood obesity from those sorts of investigations. Let me just quickly return to an earlier question. A listener writes, does the registry have any childhood anthropometric studies? And this question I think we addressed somewhat earlier when we said that we chose not to really address anthropometric measures. So the registry has a number of studies that contain anthropometric variables as outcomes or as covariates, but the registry does not catalog anthropometric measures.
The next question, is there a way to search by the type of modality, for example, whether the measure is to be administered as a questionnaire or direct observation? And yes, this is on that first search page on the left-hand side, and again, I apologize, I don't think anyone could see the screen when I was first describing this, and there are different categories that you can search by. The first is domain, and then the second is exactly what you're talking about, or what you're asking about here is measure type. So you could specifically filter on that particular type of modality.
A listener asks, has the expert panel provided some guidelines on how to evaluate the measures, or is it up to that user? At present, we merely abstract reliability and validity information where it's available for the measure in the peer-reviewed literature. And as I mentioned at the end of the webinar, that's an active topic of discussion now for NCCOR as to address the next step of helping users select a measure, particularly in areas where multiple measures are available. And also the related question of when should you use an existing measure as is, when should you modify a measure, or when should you develop a whole new measure?
Let's see, I'm reading this next one. I've collected data, body mass index, gender, birth date, private versus public school from 1,000 children, K through 12 grade, in a rural county. What suggestions would you have to proceed with data analysis, comparative data, and effective interventions to reduce obesity? The Measures Registry is really just a compilation of different measures, and this is a little bit sort of beyond our scope of what we're wanting to talk about today, but we're happy to talk to you about this perhaps offline off of the webinar. So it sounds like an exciting data set to be drawing from.
Another question, are you interested in or hearing about any measures in development that focus on assessing the process of implementation of evidence-informed obesity prevention or treatment strategies? This is a very interesting and subtle question, because as the registry is defined, we are both broad in our definition of measures, but we also focus on the 4 domains: individual physical activity and diet-related behavior, then the food environment and the physical activity environment. So I think that we would be very interested in these measures insofar as they attempted to assess environmental characteristics or behavioral characteristics. So something that dealt with the policy environment, for example, as it relates to physical activity, diet, or their consequences would be very relevant. So we'd love to hear from that listener, but it would certainly take a little more information to decide whether it would be suitable to include in the registry.
Let's see. The next question is, are there plans to include interventions that have shown a decrease in body mass index and or waist circumference? And again, the Measures Registry includes all of the measures that are used to, let's see, I'm going to go back to the definition here, tools and methodologies to assess individual diet, physical activity, and environments and behaviors in which they occur. So, if there was an intervention that was using a measure that then had as an outcome, something related to body mass index or waist circumference, then it would be included for that reason.
Another really interesting question, are the measures organized with respect to value in public health surveillance versus health outcomes? So I think this is a fascinating axis to try to understand measures and their utility. To date, we haven't abstracted information from the papers concerning the value of the measures we found with respect to these two different functions. And I think one reason for that is it's hard to know how to select that variable, because how to decide how to do that, since it's probably not on page 7 of each article. On the other hand, it's key to deciding whether or not to use a measure as it relates to your particular study goals or the purposes that you're selecting a measure. So that's an extremely interesting point, and one we might explore in the future as we think of ways to add value to the registry.
Right. I mean, I think that these, several of these questions are really getting at the points that David was discussing earlier, and, where do we, this is really sort of the first step or the building block for some of these future discussions and future ways in which NCCOR can try to facilitate some of these questions for the research community and for practitioners as well.
I'd also like to address the next question. Is this effort linked with the GEMS effort at NCI? So yes, our colleagues of ours here in the Division of Cancer Control and Population Sciences have a registry of measures related to cancer-related health behaviors. And in fact, this is one of 8 or 10 HHS-based registries of data and of instruments for measuring various health behaviors and health outcomes. And at the moment, we think of these as a series of profoundly useful tools and also experiments in a way for working on what is the best way to deal with the mass of data and measures that exist out there in the environment. So we're at a stage, I think, where we're letting 1,000 poppies bloom, and we are trying to learn from all these different efforts and share our experiences and work towards the most efficient and most useful ways to disseminate the myriad of federal and non-federal resources available in the cancer, in the health, and in the obesity research domains.
So the next question, our company designs and installs school gardens across the country. Would our experiences and observations of school gardens integrated in the curriculum allow us to author a measure on fighting childhood obesity on the ground level? And I'm sorry, I'm going to have to
Well, Jill is stepping out a little. She's got a slight cold. I'll address this question. Yes, it would be really interesting to develop measures related to the development of school gardens. I see this as part of an effort to assess environmental factors influencing food and physical activity. To maximize the impact of your measures development, I would urge you to collaborate with perhaps a researcher from a school of public health or a department of kinesiology or department of nutrition. By doing this, you could increase the likelihood of publication and of wider use by both the research and evaluation communities.
So the next question is about whether we would be interested in measures of weight stigmatization. And indeed, this was part of the individual dietary behavior domain. We do have many different questions related to many different constructs within this broad area related to dieting and different variables around that. So definitely, yes, we would be.
A listener writes, most measures assess individual behavior or environmental factors related to eating and physical activity. Are there no environmental or organizational measures that assess the adoption and sustainability of obesity prevention treatment strategies? So yes, most measures assess those first four domains because the registry was designed to search for and then collate information about measures in those four domains. We did pick up some measures related to aspects of policy and organizational structure and characteristics, but I think it's an extremely interesting suggestion that we improve our effort to find and abstract measures that assess the adoption of treatment and prevention strategies. So that's definitely a point well taken and one that's going to be on our table to discuss. And indeed, we know who the person that gave us that question is, and we'll get in touch with them probably for some more clarification. So thank you.
Okay, the next question, if I want to look for measures that have been used in schools, will searching for school help me find those measures, even if that word doesn't appear in their title? Yeah, this is a great question. And the way the searching mechanism is now, if that word appears anywhere within the abstract or in any of the data that we've abstracted, then it will, by searching for school, that'll show up. So it doesn't have to be in the title of the measure or the title of the abstract. So school is actually something that we've considered, thinking about using that as one of our filter options as well. Because that is an area that we've heard from people that they're interested in. So thanks for that question.
I'll do this one. There's a question via email. Are the physical activity measures inclusive of screen time assessment? Yes, physical activity was defined to include both activity and sedentary behaviors. So screen time would be included, and measures devoted to screen time or any aspect of sedentary behavior would have been included if they were identified through our search process.
So I'll say the last question that we're seeing here is it strictly oriented toward obesity, or are metrics also included that address underweight? I think that this is an interesting question. It definitely is specific to childhood obesity and obesity prevention, but obviously I'm not exactly sure. I can't probe the person who wrote this question to find out a little bit more about what their interests are, but we can imagine how those are obviously related within the weight spectrum, and particularly with eating, the food environment and also the physical activity environment. I mean, I can imagine a lot of questions where that would be related. I'm checking to see if we're getting more information here on that. Maybe not. But so right now, no, you couldn't. We're not looking for measures that are related to underweight. However, obviously, some of those measures that are used in these childhood obesity studies would also be relevant for some of these other questions as well that folks are investigating. Did something else just pop up, or was that our? So do you see this next question? is asking specifically about, is there a place where we define the terms used in the database? And next to the different domains and phrasings that we're using, we do have what are called, I guess, little tooltips or hints that you can scroll over, and you can see some more information about what exactly do we mean when we're talking about the food environment. And you can see that that actually does include also sort of policy-relevant variables as well within that domain. And we do that for the age groupings and sort of for any different term that we're using.
The icons are small question marks.
Thank you, yeah.
We already addressed that.
Mm-hmm.
So it's 2:58. We've come to the end of the questions. Thank you very much for all these really terrific questions and thought-provoking questions. And thanks very much for your attention. There's one more minute, so we'll stay on the line if anyone else types a question in. And otherwise, much appreciated. We hope you'll use the registry, and we hope you'll send us new measures. And we hope that you'll help us triumph over childhood obesity, which is a profoundly serious public health problem. And we're glad to see people attempting to address it.
Okay, so go ahead. So there is one additional final question. Are there any measures related to breastfeeding practices and behavior? I couldn't find any when doing a search. So this is a great question, and I know when we actually spoke about the Measures Registry and the Catalogue of Surveillance Systems recently at another institute here, National NICHD, National Institute for Child Health and Development. And this was a question that was asked, and I guess more broadly also, looking at measures also related to pregnancy as well, and sort of how we're defining that spectrum and relevant factors related to childhood obesity. So I think this is really interesting. It's interesting to hear that you're not finding any when you're doing a search, and so we'll need to go back and look at our search criteria and investigate that a little bit further. So thank you so much for that question.
It's a candidate for a new domain to include in the registry, so
yeah.
Very point taken.
And I see an additional question about eating during pregnancy, and I know that there are some questions related to the Diet Quality Index for pregnancy when I just happen to remember that off the top of my head. I have to do some more searching related to pregnancy to see what is in the Measures Registry. So that wasn't a specific exclusion criteria, but I think it's always relevant for us to look at particular concentrations to see how those are or are not being drawn out in our abstraction process. And we're really interested in the feedback loop to being sure that as we continue to update the registry, we're capturing some of these variables that you're looking at here as well. So thank you so much.
Okay, everyone, have a great afternoon. Bye.